Hello everyone, you are all welcome to lecture number 1271, and today's topic is unhealthy teeth and inflammation of gum can open the door, or we can say it is connected to different type of diseases. So healthy teeth and healthy gum is very important, and you have to take care of your mouth hygiene. If I say mouth hygiene means don't allow bacteria to stay inside mouth and grow by keeping your gum that is under chronic inflammation and loose teeth or with cavity, not visiting the dentist to take care of filling and skilling, cleaning, all these things. As you know that mouth is the door of entry of lot of pathogen and bacteria, and it is mouth from where they have access to enter to our bloodstream, and once they have entered to our bloodstream, they can multiply and they can cause different type of diseases. So first is we will get respiratory disease where our lung will be affected, asthmatic condition, cardiovascular disease. Diabetes is also linked to your inflammation of gum, and this gum inflammation is serious issue. Anybody who is suffering from bleeding of the gum and loose teeth, they have to be very careful, and they can be subjected to different type of diseases. So most of the people, they don't care for oral hygiene because they don't have any idea that there are a lot of diseases which are directly linked to their healthy gum and healthy teeth. So I will give one by one, and also I will discuss what are their symptoms and treatment point wise. So some recent research publications in American Journal of Dental Health indicates that the gum inflammation and your teeth unhealthy condition are directly linked to diabetic disease, sugar problem, and they have mentioned in that paper that is very interesting finding that once we have chronic inflammation of gum inside mouth, oral inflammation can lead or cover the inflammation in whole body. That is the very serious matter. Once we have gum inflammation, bleeding inflammation, we think that it is limited only to our mouth. No. Gum inflammation means it is connected to the inflammation of whole body. And once the whole body is having inflammation, that is the mother of all diseases. According to WHO, I have already mentioned this while I was delivering on chronic inflammation. So here again, the chronic inflammation and unhealthy teeth, unhygienic oral condition is responsible of damaging the whole body. This is the latest information. So here I have given unhealthy teeth and gums can contribute to various diseases. unhealthy teeth and inflated gums can contribute to different types of diseases. One, that is oral connection of diseases. The oral connection means mainly it is unhealthy teeth and bleeding or inflammated gums are involved. Bacteria in the mouth enter the bloodstream and affect the other organ of our body, our whole body. And that chronic inflammation in the gum, the chronic inflammation in the gum, what dentistry department, dentists they call it, that is dentitis. Dentitis means it is inflammation. ITI, if anywhere it is linked, means there is chronic inflammation. So this chronic inflammation of your this gum is called dentitis. So periodontitis is very, very serious. If it is there, it must be treated and can increase the inflammation in all part of your body. So if you are suffering from gum chronic inflammation, it means your whole body is suffering. These are all the latest research findings. So please control and take care of your oral hygiene, and please see how many unhealthy teeth are there, means with cavity or they are loose, they have inflammation. And also if such condition is there, please visit to your dentist to have refilling or go for root canaling or capping to cover that situation. So what are the diseases? Number one, cardiovascular disease. If you have gum inflammation and unhealthy teeth, you have high risk of heart attack, and also it is linked to high blood pressure. So in many cases, once your oral hygiene is okay, you don't have bleeding gum and loose teeth with cavity, it means your high risk of cardiovascular problem of high blood pressure is reduced. Number 3, diabetes. Recent research studies suggest bi-directional relationship between inflammated gum and diabetes. They mention in the paper that is called bi-directional condition, means your gum chronic inflammation and diabetes, they have very strong relation. Number 4, respiratory infections. Your respiratory infections are also linked to your oral health. Bacteria from oral infection can cause pneumonia and other respiratory issues like bronchitis, asthmatic condition, and difficult of inhaling air, getting chest pain. All these conditions, they are also linked to your oral health. That is means unhealthy teeth and your gum is having inflammation. Number 5, rheumatoid arthritis. Rheumatoid arthritis, latest research publications indicate the strong link of your unhealthy teeth and inflamed gum to get the rheumatoid arthritis. So here, number 6, there are a lot of research papers and they are indicating and suggesting that our pancreatic cancer is mainly linked to oral health, and also your esophageal cancer, that we commonly call it stomach cancer. So stomach cancer and pancreas cancer is directly linked to unhealthy teeth and chronic inflammation of gum for long time, and where we are not taking care. Lots of research papers suggest the association between inflammated gums and certain types of cancer. The most common are pancreatic cancer and esophageal cancer. Number 7, gastrointestinal disease. This is connection to irritable bowel syndrome, that is called IBS, can cause inflammatory bowel disease, and it's all indirectly or directly. Whether your intestine is having inflammation, your gum is having inflammation, your pancreas, any other organ, is all related to chronic inflammation or acute inflammation where we are not taking care of oral health. So that inflammatory bowel disease is called IBD, and this IBD is having serious implication to pregnant women because of this they may get preterm labor and low birth weight. Symptoms and treatment of your gum and teeth, that is healthy teeth and unhealthy gum. Symptoms: bleeding gums, swollen and painful gums, bad teeth, breath, jaw pain, difficulty in swallowing, and sometimes you get mild fever. These are all the symptoms of your unhealthy oral condition. Then treatment. Treatment is very simple. First, regular dental checkup means at least twice or once in a year, and cleaning, that is called scaling, good oral hygiene. Then use fluoride rich toothpaste, and even add to your diet fluoride after consulting with your dentist. And number 4, antibacterial mouthwash. Nowadays, very good mouthwash is available at least twice or thrice every week. You do the rinsing of your gum and mouth with antibacterial mouthwash. And then dental restoration by filling your cavity and also by doing root canaling or capping of your damaged teeth. Then latest treatment they are doing, that is called periodontal therapy. Periodontal therapy means here they go for deep cleaning by doing some minor surgery, and in that case whatever problem is there, chronic inflammation and some unhealthy teeth, they treat it very well. So that treatment is also there. And now I am telling you the cost of oral health. If we go to America and Europe, especially in America, I have seen it. It goes from US dollar 500 to 3,000, 4,000 US dollar. Minimum is 500 US dollar. If I calculate in Naira, it will be around 1 million Naira. And in India is the cheapest in the world, $3 to $50, that's all. All this therapy, what it is done in America in $1,000 or $2,000, it can be done in almost freely. $3 or maximum it go up to $5. I mean $50. Come to Nigeria, it starts from in Abuja, 40,000 Naira to 150,000 Naira. Means it is again from $50 to $100. That's why a lot of East European American, African, they go for medical tourism because even after spending the air ticket, still it is cheap. Because in America, if you are doing the same thing, you are spending 4,000-5,000 US dollar, especially when some very specific treatment is there. And if you buy the ticket, your return ticket will be $1,200. So still you will save 3,000-4,000 US dollar. So that's why, and dentistry is very advanced in India in terms of its surgery, implant, and also regenerative medicine. And next lecture I am going to deliver on regeneration of teeth, new teeth, with that isolation of gene, protein. Now in Japan they are doing this therapy. If you have lost your teeth, go and get injected that protein, and within short duration of time your new teeth will be developed. So that I will deliver in next lecture. So with this I will stop. Please take care of your oral hygiene and chronic inflammation, bleeding gum, because it is linked to different type of your health problem, disease and health condition. Once again, thank you very much for watching the lecture.